Barker.
My Lords, I very sincerely thank the noble Lady Baroness Barker for securing this debate. And I kind of slightly don't thank her that I've had to throw on half my speech out because she's covered it so comprehensively already, but it was a great introduction that really set out the issue of workforce that the subject directly addresses, but also the true crisis in sexual health. And I'd echo the reflections from the noble Lady Baroness Barker about the importance of relationships and sex education. That's the foundation of prevention. And that's clearly not being delivered at anything like the standard that it should be to our young people, and that means we are failing, utterly failing our young people. It's a pleasure to follow the noble Lord Hunt, and he and I have had our disagreements in recent times, but I entirely agree with everything the noble Lord just said. And I think very much I would echo his comments about public health, and that this government has essentially abandoned public health as a way of ensuring that we have a healthy society that enables the people in it to thrive and live to their full potential. And the failure to tackle the issue of ultra-processed foods, our broken food system, as well as issues around alcohol, I'd add the failure to restrict gambling advertising and indeed to allow the gambling industry to go totally out of control, which is meant our society presents a great threat to many people. But returning to the very specific issue we're talking about here, when I was reading the briefings here and I came across the term neonatal syphilis, and what I actually knew about neonatal syphilis before this actually came from reading history of Georgian and Victorian England. That's where my history came from, and if you read some of novels of that era, there's some very vivid descriptions. They mightn't have known the cause, but they could describe the effect. So I actually went and looked, and actually I came across a website for the Centre for Disease Control and Prevention in America, setting out the reality of neonatal syphilis, which is frequently stillbirth, miscarriage, or neonatal death. If the baby survives, among the effects are blindness, deafness, developmental delay, and skeletal abnormalities. Now, it's interesting that there's a real parallel between what's happening here in the UK with different structures and what's happening in the US, because the US, as the CDCP says, has an acute failure in terms of neonatal syphilis. The amount of babies being born with neonatal syphilis in 2020 was 10 times as much as in 2012. The CDCP says that testing and treatment during pregnancy could have stopped 88% of those cases. Now, the reason why I reflect on those US figures is because what we're seeing increasingly in our healthcare system is an Americanisation, a copy of the models of the US healthcare system, an import of the companies from the US, an import of people with professional experience, particularly managerial experience in the US system. And this is a system which the CDCP, citing the syphilis figures, says is a total failure. And I think that's something we should really be reflecting on. Now, before I come to the next section, I probably should declare my position as a Vice President of the Local Government Association. And I do have to pick up figures that have already been mentioned, but that have to be highlighted, that among the largest reductions in public health spend since 2015 has been on sexual health services, 29%. Yet at the same time, there's been a very significant increase in demand for sexual health services, nearly 4.5 million consultations in 2022, up a third in a decade. So we have, of course, we're always hearing elsewhere in your Lordship's House about rising costs, and sexual health clinics, sexual health services are no more immune from the costs of rising energy prices, rising staff costs, etc., than anywhere else. The funding's falling, the demand is increasing. So, of course, what's happening is the needs are not being met. And I think I have to reflect back on the debate earlier this week in the budget, and member after member of your Lordship's House got up and spoke about broken Britain and our broken services. And Noble Lady Baroness Vere for the government at the end said, "Oh, I think you're all being too gloomy." Well, I'm afraid if we look at the state of our sexual health services, the phrase "broken Britain" is really sadly appropriate. Now, I come and I acknowledge, drawing on the excellent briefings that we've received, to the particular issues around training. And we have received demands which seem perfectly fair and reasonable, that all sexual health medical training posts are 100% funded through the NHSE, in the same way as posts in primary care, oncology and public health are funded, and that the NHSE is accountable to ensure that some of those recruitment gaps, which the Noble Lord Hunt referred to, are actually filled in. And I think this is really important, and this relates to some of the other debates we've been having about the importance of expertise and proper full medical expertise being involved in all levels of the health service, that no service should be allowed to operate without a genitourinary consultant within it, and meetings of organisations and commissioners must include those. I come to a couple more very specific asks. Now, we have some contrast in asks from the briefings. The Terence Higgins Trust calls for a high-level sexual health commission to address these issues. The National AIDS Trust is calling for a national sexual health strategy. I don't have a particularly strong position which one of those approaches is the right way to approach this crisis, as all of these organisations are saying with different words. But is the government going to take a serious, significant step to act? Yes, it may not have very long to go as the government, but this is something that really cannot wait until we've had an election, whenever that is. I come back to an issue that I've also raised quite a number of times before in the House, which is about the patchy provision for postal STI and HIV testing across England. Only during one special week, the National HIV Testing Week, can everyone access this testing from a single service. That makes England an outlier. Both Wales and Scotland already have national HIV postal testing services. In Wales, that also includes STIs, and the Scottish Government is actually moving in that direction also. It would surely be cost-efficient and effective to have available to everyone a national, in England, HIV and STI testing service. It would be an extremely good spending of government money. I also briefly wanted to raise the issue of chlamydia testing. Now, we had the full national chlamydia screening program with both young men and women included, but that has actually been cut back in 2021 to preventing chlamydia infection to reducing the harms of untreated chlamydia. Now, the result of this is chlamydia has come to be seen as a women's issue. Of course, infection occurs in both sexes, but of course, the issue is not being drawn to the attention, particularly of young men. So, will the government reverse that change and reinstate the full national chlamydia screening program service? And the final thing that I wanted to address was the issue about people living with HIV who are no longer engaged with services. Now, the government estimate is there's about 14,000 people who've not been seen at their HIV clinic for at least a year. That's a real risk to the health of people living with HIV and a significant threat to the government's goal of 2030 ending new HIV cases. Now, of course, disengagement is related to many issues relating to other policy areas, poverty, homelessness, many issues that the Noble Lord Minister can't deal with. But surely there should be within health a program to re-engage people who should be being cared for with HIV in their own interests, but also in the interests of the national health and in the interests of the whole of society.
My Lords, I'm very grateful to my noble